Patient-Oriented Discharge Summary aka PODS is a simple tool used to improve the hospital transition experience for patients. The period of transition from hospital is a vulnerable time for patients. It is important to clearly communicate information that patients need to know when they leave hospital. PODS is designed according to best practices by providers, caregivers, and patients, specifically hard-to-reach patient groups such as those with language barriers, limited health literacy, and mental health conditions. PODS is easy for patients and families to understand and act on. PODS contains 5 sections that are actionable and useful for patients and their families. Signs and symptoms and expected and worrisome things to watch out for after leaving hospital. Medications and instructions such as where prescriptions are faxed. Follow-up appointments scheduled for the hospital and in the community. Changes to daily activities and diet. And telephone numbers and resources for patients and families. Since PODS is an interdisciplinary tool, every member of the healthcare team makes their own unique contributions, and when we bring them all together, it forms the complete PODS handout.
Now, let's delve into how each team member adds their part to create the comprehensive handout. Let's begin by discussing the role of nurses and allied health members in contributing to the discharge handout. Nurses and allied health primarily add important discharge instructions through the patient-oriented discharge summary power form. Multiple team members can create and sign and submit power forms whenever they need to provide discharge instructions to the patient. Each time there is new information that needs to be added, they can create a new power form. There are 2 ways to access the PODS power form. Both method involves opening the patient's chart and selecting the Discharge tab from the patient summary. If the Discharge tab is not visible, you can add it by clicking the plus sign and then double-clicking on the Discharge option. The Discharge tab should appear to the right of the last tab. The first place to find the power form is from the Discharge Planning heading. Click on the down arrow to the right of the plus sign and select the Patient-Oriented Discharge Summary option. The second place to find the power form is from the Discharge Documentation heading. Click on the down arrow to the right of the plus sign and select the Patient-Oriented Discharge Summary option. Once you have the power form open, you may notice that some sections are already filled out. This is because it's a multidisciplinary tool, and certain sections might have been completed by allied health members and providers. Under the first heading, Patient Instructions, you will find the discharge instructions provided by the provider using their unique contribution method. As you scroll down the power form, the nurse can fill out any relevant sections. For instance, if the patient has identified a contact person they'd like to involve in their care, you can enter their name and contact details in the I would like to share this information with my support person section. You can input this information into the free text box provided. Following that, you can document the reason for the patient's hospitalization in the reason I was in the hospital was section. In our example, the patient was admitted due to appendicitis. You can also record any potential signs or symptoms the patient might encounter and provide guidance under the How I Might Feel and What to Do section. For our example, this could include managing discomfort from gas after laparoscopic procedures. In the Changes to My Routine section, you have the option to include any changes that the patient should be aware of after discharge. For our example, we will note that the patient should limit sports and strenuous activities for 1 to 2 weeks. In the My Upcoming Appointments and Details section, you might find appointments that have been entered by the multidisciplinary team. In our example, the physiotherapist manually added an appointment for Powder River Outpatient Rehab since it's not yet integrated into the electronic health system. For appointments that are ordered and booked on Cerner, they will automatically appear. In the Hospital Contacts section, you can enter contact information that the patient might require after leaving the hospital. For our example, we'll add the contact information for our CML along with their phone number. In the Other Information for Me section, you can input any additional information that's important for the patient to know. This might include instructions for caring for drains and wounds, Lastly, in the Medications I Need to Take section, you'll find the patient's preferred pharmacy and prescribed medications completed by the provider during discharge medication reconciliation. If any changes are needed, you can directly edit or delete information. In our example, the patient has decided to switch to the Safeway pharmacy nearby, so we will update the preferred pharmacy accordingly. On the Community Support tab, you can include additional resources for the patient, such as community support options. In our example, our physiotherapist has already included a community contact for the patient post-discharge. Once you've reviewed all the information on the Power Form and made any necessary updates, you can click the green check mark to sign the Power Form. The completed and signed Power Form can be viewed under the Form browser. If the information you entered in the Power Form is incorrect or requires updating, open a brand new Power Form and edit the information there. Do not alter and modify a signed and completed Power Form. In our example, we forgot to enter the correct length of time. We can go in and modify it. Similarly, allied health members will utilize Power Forms to contribute their discharge instructions. Their process for entering information aligns with that of the nurses. Once again, if any changes or updates to existing instructions are needed, they should be made by creating a new Power Form. Once all members of the interdisciplinary team have added their instructions, the provider or nurse can open the consolidated PODS handout. This is the final opportunity to make any last-minute changes or alterations before presenting it to the patient. To access the PODS handout, navigate to the Discharge tab and scroll down to the Create Notes section. From there, select the Patient Discharge Handout option. The Patient Discharge Handout contains all the information contributed by different healthcare team members. As you can see, the details we entered earlier have been integrated into the handout. For instance, under My Contact Information, we added the support person's name. Further down the handout, you'll find My Hospital Stay, which lists the providers who have been involved in the patient's care. This information is derived from the relationships established between the providers and the patient during their hospital stay. Another component that is automatically pulled from registration is the Sharing of My Information section. The When to Get Help section of the handout is automated and appears in all patient discharge handouts. If the information is not applicable or needs modification, you can make those adjustments directly in this section. All other components on the handout are pulled from the various Power Forms or from the provider's contributions on their workflow page. If there are any last-minute changes that need to be made, you can directly modify the handout. For example, if we forgot to enter catheter and Foley leg bag care instructions for the patient, we can double-click into the text box under the Other Information for Me section and directly add in the care instructions. This is applicable for any sections of the handout. At the bottom of the handout, you will see that this document is a consolidation of documentation form multiple contributors disclaimer. This ensures that the patient is aware that multiple team members added information on the handout and not all the information came from the healthcare professional that signed and printed the handout. One last thing to note, if someone else has already created and signed/printed a discharge handout for the patient, this disclaimer will be present at the top of the handout. You will need to communicate with the team member directly to sort things out. One more important detail, any empty subheadings will automatically disappear when printed. Therefore, there is no need to physically delete them. So, once you're confident that the handout has been filled completely and thoroughly, click Sign/Submit. Finally, you have two options to complete the process. You can either click Sign and Print to directly print the handout yourself or select Sign and ask the unit clerk to print the handout for you. In this example, we will go ahead and print the handout ourselves. In the Medical Record Request window, select the printer from which you'd like to print, and then click Send. The printed PODS handout should resemble this PDF version. As you can see, only headings with filled-in information are present on the handout. The final step in this process is what we call Teach Back. It's a crucial communication strategy that actively involves patients in their care. Here's how it works. The nurse or provider explains the information on the PODS handout to the patient. The patient then uses their own words to describe what they've understood from the handout. The nurse or provider reviews what the patient has said and clarifies any missed instructions or points of confusion. The patient confirms their understanding of the PODS handout. This teach-back approach ensures that patients not only receive important information but also comprehend and can apply it correctly, which is vital for their well-being. It's a collaborative way to make sure everyone is on the same page regarding their care. After successfully conducting the teach-back session with the patient, it's essential to document this in iView. Here's how to do it. Navigate to the Adult Education section in iView. Look for the Discharge Planning Education subsection. Complete all the necessary data boxes with the relevant information about the teach-back session. Proper documentation ensures that the patient's education and understanding of their care plan are well documented for future reference and continuity of care.